make yourself familiar with the needle that you are using for the biopsy. This one is a bar, it's purple in color, therefore it's a 16 gauge. I hold it like this, and I practice to load and unload the needle only with one hand, with this finger, index finger, like this. 1, 2, fire. 1, 2, fire. 1, 2, fire. 1, 2, fire. This is an achieve type of needle. It is a 14 gauge needle, and it's written here. It has two buttons, A for fully automatic and D for a stylet only. This A and D are here. So hold a needle like this in your hand. With these two fingers, you load it. When you do one time, you can see that stylet is still out. When you release it and do it one more time, then the needle goes in and it's ready for firing. So there are two modes again for this one. The mode that is automatic is the one that it takes the needle stylet out, and then the cutting part comes, and there are actually two clicks that happen here, but you hear it as a one click. But two things has happened here. First, the stylet came out, and then the cutting part comes out. If you want to see how the stylet comes out alone, you use the D part. So you go in your target, you press the D button. You can see that the stylet comes out, but still the cutting part is not out. So then you can press A for the second phase, which is cutting part. If you put your needle like this, and here's the target, and you're aiming toward the ribs or toward the chest wall, then when you fire it, you may actually end up hitting the ribs or chest wall. Therefore, what we do is that we will get close to the target like this, but then we move our hands so that the needle is parallel to the chest wall. We want to have about 2 centimeters of free space in front of our needle when we fire it. Therefore, you come here and you get close, and then when you fire it, this is what's gonna happen. If you take a closer look at that, you can see where is the area that the sampling will happen actually. Okay. Here is the transducer. You can see that there is a notch here. That is usually the left side of the screen away from me. And then I hold the transducer. I use my hand to have a stable position on patient's body like this. And then I can easily maneuver this transducer. You hold the transducer always vertical. Try not to do the scan like this. You do the scanning for the biopsy always vertical. Hold the transducer vertical, then you find your target. After you find, imagine that here is where the target is. After you find your target, you look at the transducer, just like the video that you're seeing. You tilt or you rotate the transducer in this axis so that you see this picture. This means that it's tilted to the left, this tilted to the right. I want you to adjust it on the target by rotating the transducer in this position so that you see this picture. The long axis of the transducer is just facing toward your shoulder and toward your eye. Then that means that what you want to do, enter the skin at this point here, because we want to hold our needle in a position that the needle basically points toward the center of this transducer. So now that this transducer is in the right position, if I put my needle here and go straight in this axis, I can be sure that the picture of the needle will be seen on my ultrasound transducer. And if I'm holding the needle like this, I know that the needle is going toward the left too much. If I hold the needle like this, I know that it's going to go to the right. And if I see this picture when I'm looking at the needle, then I know that it is in the right angle. Okay, now we want to talk about the numbing medicine. The medicine that we use usually is lidocaine buffered with sodium bicarbonate to decrease the burning sensation. Lidocaine blocks voltage-dependent sodium channels, doesn't let the action potential to pass through the nerve, and that's how it prevents the pain sensation. So what you do is that you find your target, then you rotate the transducer as we discussed so that you see the long axis of transducer with your eye. That basically long axis is pointing toward your shoulder. Then you know that your skin entry point for the needle would be here, about 5 millimeters away from the edge of the transducer. You tell the patient that you're going to inject a numbing medicine, and then you put the needle here and slowly, very slowly go in. Now you stop for a moment, you start injecting numbing medicine as you pull the needle back slowly. As you're injecting, pull the needle back until the tip of a needle comes to the dermis. At that point, when you're injecting, you will see the swelling that happens on the dermis, just like when they injected TB. We are not going to take the needle out of the skin. We entered the skin one time, we're going to keep the needle in, but we will make that wheel around the injection site. We give it a few seconds now, and you inject as you are advancing the needle slowly. There is no need to do this jerky movement to poke something, just slowly go in. When you do that, always the injection of the medicine comes slightly in front of the needle. As your needle goes in, the patient will not have any pain. Here is a scalpel that we use to make an incision. You put your finger, index finger on this knob here, you press it down, and then you pull it backward. And then after you're done with it, you again push it forward so that it covers, and then you put it on the table. For ultrasound-guided biopsy, you only insert half of the length of this 11 blade in the incision. So you go here 5 millimeters away from the transducer, and you just go one time and then come out. When you want to put the needle in, you hold it like this. The reason for that is that I don't want my thumb to be on the trigger, because then by accident, if I want to push to the tissue, I may by accident fire the needle, and that's not what you want to happen. Therefore, when you are inserting the needle, you hold it like this when your thumb is off the trigger. So again, the maneuver is like this. You find the target, you try to rotate it in a way that you see the long axis of the transducer, not like this, not like this, like this. Then we know that this is the area that we're gonna go in. Then try to, instead of making the transducer like this, with pushing this side, try to push the back part of it down. Just lift up this side. Then you will see this picture. You know that in this angle, this is the right, this is too much to the left side, so too much to the right side. This is the right angle. Another problem that I see, to push hard to get a good image, and then to push the front side of the transducer that is facing them too much down. Imagine what happens. The angle of the transducer is now this angle. The needle is going to go in like this, and this is not a good angle to see the needle, because the ultrasound wave is going to hit this needle and go away without coming back to us. So what is the approach that we can take to solve this problem? Instead of holding and pushing this side of the transducer, you intentionally do opposite and hold the transducer like this and push the back part of the transducer down as much as you can, so that even this side of the transducer may be even 1 millimeter off the skin. As long as you don't have air in there, is fine on the image, air artifact. Then when you go in like this angle, what happens is that now the needle and your transducer are more like parallel. Instead of being like this, that has a steep angle, try to maneuver like this. Therefore, you will see a bright needle object on your screen. Here's the biopsy. You find your target, you change the angle of the transducer when you're holding it vertical, you rotate it so that you see the long axis. You put the needle in a little bit deep and then make it horizontal. You warn the patient, and then you fire it. You take a picture on the 90 degree to make sure that the needle is passing through your target. Then keep this in on the target. Take the needle out when your left hand is still putting some pressure at the site of biopsy to prevent bleeding. You unload by just pressing one time here. You see the tip of a needle contains a sample. I unload it, load it one more time, go for the second sample, exactly the same thing. Again, warn the patient, horizontal, fire, take it out, unload it, and go for the third one, and then you leave a clip. So here's a troubleshooting technique. Imagine that you inserted your needle, you look at your image, you can see your target there, but you don't see your needle there. So what is wrong and how you can correct it? You hold the transducer totally vertical. I don't want you to hold the transducer like this or this. I want you to hold it exactly vertical. Then you translate it in this direction. You go from left to right, and then you look at the monitor when you're doing that. When you're moving from left to right, first, for instance, I see my target in this example, and then when I move a little bit more, I see my needle. Therefore, I know that my target is here, my needle is here. What you do is that you go to your target, you take your needle out a little bit, you change the angle of the needle toward facing underneath the transducer, and then you go in, and when you do that, you can see the transducer, you can see the target and your needle at the same time. Now you're done with your biopsy. Here's our incision. We want to put the stereo strips on it. You get the gauze, you put the hydrogen peroxide, you clean the center of this incision, and then you go around it. But after you went around it, do not go back, because your gauze is now dirty by cleaning the tissue around it. You throw this away. Do not put that back on the tray. You throw it away. You get another clean gauze. You dry very well the center incision. If you want, you can dry the tissue around it too, the skin around it. But after you did, don't go back to this incision because it's dirty, and I throw this in the garbage, not back on the tray. Then you get the stereo strips. The stereo strips, usually they come in this shape, and then they have a folding on one side. If you fold it and then you use your finger, you can just drag and take this part off. Now you hold your stereo strips with just tip of the finger like this, and after you did that, the wrong thing to do is to start doing this. We don't want to do that, because if you do that, this stereo strips has only one chance to stick, and if you do this, then it's not going to stick to the skin. So that's not usable. Again, you just hold the stereo strips with the tip of your finger. Don't let this one to touch anything. Then you come on the incision. Here is my incision, and I put this on one side of the incision. I press it so that it sticks to the skin. You can see the incision is open. Then I pull with this one. I pull that way so that the skin is closed. You see the incision, how you can nicely close the incision. Then you press on the other side. Again, you grab this with the tip of your finger. Do not touch anything else. Put it on one side of incision. Press, pull to close the incision, and another one like this. You do it 3 times, and then you're done.